Welcome back to Drug Talk, everybody. In today's video, I want to quickly go over 3 things you should be aware of before using Ponstan or Mefenamic Acid. Number 1, how do you use Ponstan for painful menstrual cramps? The first thing to know about using Ponstan for painful menstrual cramps is that this medication is typically not taken for the full course of menstruation. The recommendation is to take 500 milligrams initially, beginning at the onset of bleeding and other symptoms. This would usually amount to 2 tablets as your initial dose. Following the initial 500 milligram dose, it's then common practice to use 250 milligrams or 1 tablet every 6 hours. Some individuals may use this medication longer than other patients based on the severity of their symptoms, so if you feel like you fall into this category, it's important to have a conversation with your prescriber and leverage their clinical experience to see how they can move your care forward. Now, the specific dosing for this medication really does vary based on the diagnosis. As an example, in premenstrual syndrome, patients may start using this medication on the 16th day of their cycle, using 500 milligrams potentially for every dose. The important point here is just to make sure that you follow the instructions given to you on your label by your prescriber. Number 2, when you start using Ponstan, you may experience gastrointestinal side effects. There are a few different GI side effects that may arise while using Ponstan. In general, these side effects we're about to go over seem to happen somewhere between 1 and 10% of the time. In no particular order, some of these side effects may include abdominal pain, nausea or vomiting, constipation, diarrhea, and flatulence are possibilities, and others may experience heartburn or indigestion. One common counseling point that pharmacists tell their patients when giving them Ponstan is with regard to abdominal pain. We know that if you take this medication on an empty stomach, it increases the likelihood of experiencing that abdominal pain. So if you make an effort to take this medication after having a meal, you can decrease or potentially avoid the abdominal pain altogether. For all these side effects, the rate in which they may occur for you could vary depending on the dose that you're using and the duration of therapy. And number 3, there are 2 neurologic side effects that can occur while using Ponstan. Up to 10% of patients who use Ponstan may experience either dizziness or headaches. Similar to the GI side effects, the dose and duration of use may play a role in how frequently these side effects show up. For some patients, the dizziness and headaches are very short-term side effects, but if they persist, it's worth having a conversation with your prescriber to see if this is in fact the right medication for you or if you should be switched to something different. The dose may also be up for a change. That's all we're going to talk about today with Mefenamic Acid or Ponstan, but before you take off, I wanted to quickly let you know that you can pick up a copy of my book, The 5th Episode, Inside the Manic Mind, by clicking on the link in the description of this video. Take care.